I've had SI joint pain right in this area, mostly on the right side, for the past 2 weeks because of my pregnancy. I've noticed that I'm standing in more of this anterior pelvic tilt. So in today's video, I'm going to show you exactly what I'm going to do to decrease the pain. I'm doing these exercises pretty much daily because they give me instant relief. Now with all of these exercises, I'm really focusing on my hip mobility, specifically into internal rotation. I'm also working on the stability of my hamstrings and my glutes and the muscles that connect into my SI joint. But the reason behind the hip mobility is because when we stand in this anterior pelvic tilt, it's really a compensatory pattern. Now, obviously, when I'm pregnant, I'm just gonna stand more like this position because the weight is more anterior for me right now. But just in standing in an anterior pelvic tilt, a lot of the time people with SI joint pain will do this because they lack hip internal rotation. So it's almost like the body's way of getting indirect hip internal rotation. Now I'm still working out and I notice that I have a lot more pain when bending over or going into a unilateral exercise such as a split squat, specifically with a load. So anything unilateral where I need a lot of that SI joint stability usually doesn't work well for me. But once I do these exercises, it seems to feel so much better. So I mentioned that the pain is more on my right side than my left, and that I'm most likely lacking hip internal rotation, which could be contributing to this pain. So I'm going to test my hip internal rotation before and after I do these exercises. And then I'm also going to use the gauge of bending over, which usually causes some pain. And I'm going to see if my pain level has decreased. To check my hip internal rotation, I'm going to make sure my feet are dangling on a chair or box. And I'm going to put 2 fists in between my knees so I am only getting this motion from the hip. And what I'm going to do is on my right side, I'm going to bring my foot out as far as I can. Now what I'm looking for here, I want to make sure that my hip is not popping up. The second my hip pops up, I'm really just getting motion from my pelvis, which is basically that indirect hip internal rotation. So it's not truly coming from my hip joint. So I would say right now it's about there before I see my butt start to pop up on the chair. So I would say that's about like 10 degrees. And just to compare on the left side, probably a little bit further, maybe about 15 degrees. So I'm going to use 10 degrees and 15 degrees as a gauge and test it afterwards. For the first exercise, I'm going to grab a 10-pound weight, or a light weight will work. I'm going to lay on my back and I'm going to put the weight in my left hand like this. Now I'm going to bend my left knee and I'm going to bring it over my right leg. So when I'm doing this, I'm bringing my knee to the floor as close as I can without really rotating from my mid-back. Now when I do this, my pelvis is rotating over my right hip, and that's putting me into more of that hip internal rotation on my right side. Now with this one, you want to make sure your shoulder's down. That's the whole point of the weight. So don't think this is like a shoulder exercise too. It's really a hip mobility exercise. So I'm going to do about 8 on each side. I like to do this on each side, so I usually feel a nice little crack in my low back. That feels amazing, especially when I've been sitting all day. And I'm really trying to make sure that also my ribs are not rotating with me and they're trying to stay up facing the ceiling. They are going to rotate a little bit, but I'm really trying to get that rotation from my low back and my hips, but I'll also feel this in my mid back. There's that pop I was looking for. It always feels so good. Now the other exercise I like to do for hip internal rotation is on a foam roller. So really what I'm gonna do is put the foam roller, if I feel the top of my pelvis bone here, that is where the top of the foam roller is going to be. So it's really going to be on my pelvis, not necessarily all the way down on my hip joint. So if I feel that top pelvis bone, the ASIS, I'm gonna put the foam roller right here and lay on my side. And you'll feel when it's on a bone, like a bony structure. So from this position here, I'm just gonna feel that the foam roller is more on the pelvis than the hip. I'm gonna bend my bottom knee, so my knee is really close to the foam roller, and I'm gonna stack my hips like this, almost like I'm about to go in a clamshell position. Now from this position, all I'm gonna do is bring my hand, my shoulders, and my trunk. I'm gonna rotate downward And as I do this, my knee is down, my top knee is down, and then I'm going to rotate upward. Exhale, bring that top knee up. Exhale, inhale down. And I'm rotating my trunk with me as I come up and down. So when I'm doing this, I'm able to rotate that femur over a fixed pelvis, rotating it into more hip internal rotation. Make sure you are bringing the top knee with you as you come down and up, and you're breathing as you're doing this. Nice, slow, and controlled. I'll probably do about 10 of these on this side, and it should feel pretty good. Those are the two exercises I like to do for hip internal rotations. I'm just going to quickly recheck where I'm at with my right leg. So all I'm going to do is just recheck my hip internal rotation here, see if I can get a little past 10 degrees. So I would say right about here, I'm starting to see my glute pop up, which feels so much better in my hip. This feels so much smoother. This is like a huge improvement. And I'm not even going to check the left side since I really was focusing on the right side with those two exercises because that's the side I'm having the pain on. But my hip internal rotation just feels so much better just based off those two exercises that took me less than 5 minutes to do. Now, those first two exercises were more for hip mobility, but now I'm going to go into some lumbar spine pelvic stability. So I'm going to start with these quadruped hip hikes. I like to do these on both sides, and it just gets a little bit of rotation in my spine and in the pelvis, and it honestly just feels so good. So I'm going to get a little block. You can always use like a textbook or a thicker book, or a yoga block works well too. And I'm going to get on all fours like this. Now all I'm going to do, one knee is on the block, not both knees. I'm going to drop my other knee down to the mat, and then I'm going to bring it up. So when I'm doing this, I'm rotating my pelvis down and rotating up. This is really good at working that multifidus muscle, which is a deep core muscle. And I usually do about 10 of these on each side. So when I'm lifting my right knee up, I'm feeling this more on my left hip, which is why I like to do both sides, because there's benefits to doing this one on both sides, and it honestly just feels so good. So when you're lifting up, your knee can come to basically about in line with the other knee. It doesn't need to lift super high with this one. We're not trying to get excessive movement here. We're just trying to stabilize. Now the next exercise is really good at posterior expansion. Now I said I'm in more of this anterior pelvic tilt, which is very common for someone with SI joint pain. So this one is really good at that instant relief of really expanding the low back. So what I'm going to do is get a pillow or something soft, and I'm going to put it on my stomach, and then I'm going to get in this child's pose position. So the pillow really allows me to round my spine more. And you want it to be soft. You don't want it to be something firm. Now, all I'm going to do here is when I'm inhaling, trying to expand my low back and even my mid back. And I'm just going to sit here, quiet breathing, not a huge inhale or exhale, trying to expand. And I'm relaxing my neck. I'm relaxing pretty much everything. Now I'm inhaling through my nose and I'm exhaling through my mouth, and I like to do this one for about a minute. When you're inhaling, inhale through your nose, and when you exhale, it's almost like you're making that dragged out ha sound. So it's and then again, make sure your neck is nice and loose. Relax your shoulders. Child's pose with the breathing exercise is not one I would do if I was in severe pain where pretty much every movement hurt, or anytime I just slightly bent over it would hurt, because you are in lumbar flexion and you are in more of a tilt of your pelvis. But it is one I will do when my symptoms have calmed down. For the last exercise, we're going to work on rocking back into a posterior pelvic tilt by activating our hamstrings and our adductors. So I'm just gonna take a foam pad, if this is bonus points if you have this. I'm gonna put it against the wall. You can also use like a small block or even a chair, but the main thing is you want access to a wall so your feet can be on that wall. So I'm gonna put my feet on the wall, and I'm gonna go ahead and put my heels on this block like this. Now from this position, I'm gonna put the foam roller deep in my groin, so it's not up here, pretty deep in my groin here. And all I'm gonna do is I'm going to push my heels down, push them against the wall, very slight push of my knees inward. I'm not going into a max contraction of my adductors. And as I do this slight push in, slight push of my heels down, I'm rocking my pelvis back as I'm lifting my pelvis up about 2 inches from this position. I'm barely lifting up. I'm not going into a full bridge. As I'm lifting up, I'm just 2 inches off the ground. I can feel that my pelvis rocked back. Now from here, I'm just going into 5 inhales and exhales, breathing through my stomach, relaxing my neck. I have to relax my neck with this one. And I'm relaxing down. So you can see I'm only rocking up right when I feel my tailbone lifting off the ground, because this slight movement is tucking my pelvis back, and that's all I want. Now with that exercise, I'm going into about 5 cycles of the 5 inhales and exhales. So each rep is 5 breaths where you're slightly lifting up. Now the key there, keep your neck relaxed, just barely lift your tailbone up, and then if you can, have like a chair or something, or a block where you can put your feet on the ground. That's like the most important step of this. And then extra bonus points if you have something that your heels can push into, just make sure it's not super low. Now that I've done those 5 exercises, those are like my main 5 that I do each day. I already know my hip mobility improved into that hip internal rotation. My pelvis and my SI joint honestly feels so much better, but I'm just gonna test it, and I can tell it feels so much looser. I feel so much more stable, and I just don't feel like it's stuck or like it's about to grab me and put me in pain. I hope this helps. If you have questions about SI joint pain, make sure you comment them below. And then if you want a full plan to get rid of your SI joint pain, check out the HIP program. I will link that below as well, but that has running specific exercises just like these that you can go through that will help you progress. It works for hip pain, SI joint pain, and low back pain.